Healthcare informatics deals with collecting, storing, retrieving, communicating, and optimally using health-related information. The field's main objective is to help assure quality healthcare in medical, biomedical, and health sciences. How they go about this is through implementing technology and various other methods in order to aid in problem solving and decision making aspects related to healthcare. Healthcare informatics is quite prevalent today for various reasons. One of the reasons is based on how expensive or inaccessible health insurance can be, as people can go bankrupt or even have their conditions worsen because of their inability to have access to health insurance. However, this does not hold true for all countries, as many countries outside the US offer free health insurance. Something that I had learned from this course was that the US spends the most when it comes to healthcare, which is pretty ironic because 40% of the diagnostic tests were deemed unnecessary. And in a statistic of the top 3 ways which American dies, number 3 involved medical errors. I put great emphasis on this because of how ridiculous the situation can be. Because not only are we paying for health insurance, but we're also dying because of it, whether it be literally or financially. By dedicating more time and resources into healthcare informatics, the quality of healthcare will drastically improve and in return save more lives.
Informatics is undoubtedly an important field with endless applications. One such application can be seen in the clinical setting and is useful for both clinicians and patients alike. Both patients and healthcare providers use online portals, electronic health records, data collection devices such as those used to collect vital signs, and personal data devices. One of the first things that medical assistants do when you step into examination room is collect your data, including your height, weight, vital signs, and medical history. They're then seen inputting that data into computers. I'm fortunate enough to have a primary care physician that takes advantage of informatics through the use of an easy-to-navigate online portal, which allows me to communicate with her without an appointment and send letters back and forth. I can also view my prescriptions and read specific instructions for them for when I forget. In 2009, President Obama signed the Health, Information, and Technology for Economic Clinical Health Act, or HITECH. HITECH formulated the Meaningful Use, or MU, program under the Centers for Medicare and Medicaid Services. This incentivized providers to use electronic health records by financially rewarding them when demonstrating their use. This resulted in a learning curve for providers who didn't usually use electronic health records. The increase in use for the electronic health records leads to more comprehensive care in many ways.
Information technology also plays a large role for managers at all levels of the healthcare system. Technology can be used to aid the work of managers and their employees, but there's also needs to be standards and limits set. Time management is a very important factor in the medical field, so using information technology can be beneficial, but it should not be used to the point where it creates barriers for them. The increasing number of tools and technology becoming available can many times be overwhelming and create additional stress. In fact, it is recommended to reduce interruptions and distractions by shutting off email and isolating themselves and creating a comfortable environment to work in. From a manager's perspective, information systems tend to be used to interpret information that may help in the decision-making process. Managers can also have the responsibility of using the information in the EHR in order to demonstrate meaningful use. Otherwise, it would be difficult to be able to demonstrate meaningful use and to be compliant with the HITECH Act.
Healthcare informatics has a big impact on the policies and the numerous people involved in the policy-making processes in regards to healthcare. Healthcare informatics also improves the communication between policymakers and healthcare providers. Policymakers now have a great deal of data available to them that will allow them to make better choices when deciding on public health issues. However, the technological merge with healthcare also provides some dangers that policymakers and healthcare providers must be aware of. Patients' data and privacy must be highly secured, and policies must be made in order to protect this data. There is a great deal of liability that can fall onto healthcare providers if patients' data is leaked or mishandled. Meaningful use is an example of an impact healthcare informatics has had on policy. Meaningful use encourages the use of electronic health records and provides incentives for healthcare providers to do so, but could also lead to illegal activities by these providers in order for them to receive the best incentives. Whatever direction health informatics goes in, it is crucial for federal and state governments to be coordinated with their policies in order to keep patients happy and keep good faith between the governments and the people.
Okay, so the general article that I have read about discusses how integrating patient data using a smartphone app helped identify disease trends. The app is not available for the public yet, but it was developed by the University of Manchester, the health informatics team. And patients simply enter their symptom each day for 3 months and record it through their apps. And this long-term effect was much better than a patient visiting a doctor once in a while because of the long-term symptom record information. And while face-to-face consultation could miss the small important information. And as a professor, Will Dixon from University of Manchester said that the app is really important because of the patient usually have difficulty in recalling the exact symptom in small consultation time. But using the app, patients are more focused around with the data they have input for 3 months and making the decision based on their more so personal data. As the article mentioned, the app is not available for the public yet, but in a long-term condition, this technology gonna provide a huge opportunity and offer benefit to both patient and clinicians.